Hello and welcome to our weekly Brampton update. Today there's two matters I'd like to update the public on. One, the latest information on our physical distancing fines, and secondly, the City of Brampton's push to make sure internationally accredited physicians are able to help out on the front lines against this battle against COVID-19. I would note I'm joined by City Councillor Charmaine Williams and City Councillor Harkirat Singh, who have been working on these files. On the update on our physical distancing fines, as you know, Brampton has some of the strongest fines in the country when it comes to making sure we take the advice of public health seriously. Last week I mentioned that someone who had a house party is facing a fine of up to $100,000 because there is no tolerance for foolishness right now. Since that time, we have actually laid 8 fines. We have laid 3 fines for individuals, soccer teams that jumped the fence and chose to play at the Heart Lake field. That is not acceptable, and these teams are all facing fines. We also laid a fine just recently. We also laid a fine just recently for a tattoo, a hair salon, that despite given a warning decided to continue to operate, risking the public. We also laid a fine at a car wash where there was a group that was loitering, and we laid charges for people that went to a park. I know some people say it's okay to go with their friends and family to a park because the park is empty. No, if everyone did that, it would be a full park. The reason we've closed parks is for the best interest of the public to keep you safe. And we will not hesitate laying fines like that for those that try to sneak into our closed parks. And lastly, we issued a fine for someone that decided, because their street was empty, to have a birthday party on their street by bringing everyone out on the street. That's not acceptable. The reason the roads are empty right now is because we want people to stay at home. So just to reiterate, the City of Brampton has no tolerance right now for people that are ignoring the advice of public health. Now today we want to talk about an important campaign, and I'm grateful that Councillor Charmaine Williams has shown a lot of passion on this. She's actually been writing letters to the provincial government about the plight of internationally trained physicians. Brampton may have more internationally trained physicians in our city than anywhere else in Canada, and they are ready. They are eager to help out in this battle against COVID-19. I would note that today I'm joined by Dr. Summer Chauhan, Dr. Aisha Barizamin, who can speak to the fact that they are ready and willing to serve. And we have a third doctor, Dr. Akapafori, who actually has to work in a packaging plant today in Brampton. Otherwise, he'd be here to talk about why he wants to be in the hospital, why he wants to be in the front lines, not working in a different capacity. I would note we are so grateful for the work that the physicians and nurses are doing throughout Peel Region, but there is a huge weight on them. We need extra hands. We need everyone to be part of this solution. And I would note, if you look at the physicians in Canada, boy, do we need them. Right now in Canada, per 1,000 people, Canada has 2.7 practicing physicians. If you look at Norway, they have 4.8, and Germany, 4.1. And so we're already understaffed. The fact that we have 14,000 foreign-educated doctors, according to Health Force Ontario and the recruitment agency, speaks to the fact we've got this awesome arsenal of talent, ready, willing, and eager to help keep us safe. And I think we can learn from other jurisdictions. If you look at the state of New York and New Jersey, they have taken this approach. They have welcomed foreign-trained doctors into this battlefield of fighting COVID-19. Currently, the province only offers 200 entry-level postgraduate training positions annually for international medical graduates. We're turning hundreds, thousands away who are ready to help. I would note that the City of Brampton declared a healthcare emergency on January 23rd, given the shortages we feel we have in our community. The fact that the pressure is now only more acute highlights the need to welcome all hands on deck that want to help. Over the course of this pandemic, the province tells us we could see between 3,000 and 15,000 deaths related to COVID-19. Those numbers are staggering, and the notion we wouldn't want that extra help in this battle, I believe, is short-sighted. And one of the reasons that Brampton feels so passionately about this is we're a mosaic of the world, 119 different language, faiths, people in our city. People who have dreamt of coming to Canada, have come to Canada, are internationally accredited with their degrees, and they want to help in our time of need. And so our request to the province today, our request is to make sure people who are ready and willing to help, let's use their talent. They shouldn't be working in a packaging plant. They shouldn't be working in real estate right now when they can be helping save lives. So on that note, I'm going to ask Councillor Charmaine Williams, who's been so passionate on this file, to come up and say a few words as well.
Thank you, Mayor Brown. So last month I called on Premier Ford and Minister Elliott to eliminate the barriers faced by foreign-trained Canadian qualified doctors to practice in Ontario so that they can help us fight the COVID-19 pandemic. There are three main barriers: the cost of the examination process, the infrequency of the tests, and the lack of hospital residencies made available to the foreign-trained doctors. So Ontario and Canada has thousands of foreign-trained doctors, but Canadian qualified doctors who have been denied the right to practice medicine here. That is why I've started moredoctorsnow.ca. We need all of these doctors on the front lines, not on the sidelines. And Team Canada needs to have all the players on the field. If not, we just don't stand a chance. And if you look at the numbers, as Mayor Brown said, 4.1 doctors per thousand in Italy, and in Canada, 2.6. Are we really ready for what's coming? With all of the doctors who have applied for jobs and applied for positions, a small fraction of them are getting residencies. And instead of working as doctors, they're working in factories, working as real estate agents. And I'm telling you, everyone has at least one story of taking a cab and meeting a foreign-trained professional. That is a complete waste of human capital and human potential. More than now, and more ever than that, we need to employ the skills that these foreign-trained doctors brought with them to Canada. In Mexico, in Montreal, in Mumbai, in the Caribbean, the brain, the heart, and the lungs all work the same way. So if these doctors from these cities pass the same exam process, they should be allowed to help us get over this pandemic. We are in a state of emergency, and it's finally time to put the foreign-trained doctors who qualify to work to help keep us healthy and save lives, and not just for 30 days, but for 30 years. So tomorrow, I will be presenting a motion for approval by Council asking other cities to join Brampton in this campaign for More Doctors Now. And if you agree with Mayor Brown and myself, I ask you to visit the website, moredoctorsnow.ca, and sign your name on the line and share your voice, and let us get the message that we need more doctors now. Thank you.
I'm going to ask if there are two physicians that we have here today would like to come up and say a brief word. Dr. Sue-Marie Chauhan, if you want to come and say a few words.
Thank you, Mayor Brown. My name is Dr. Sue-Marie Chauhan. I studied medical school in the Caribbean at Medical University of the Americas at St. Kitts and Nevis. I'm born in Canada, so if you're wondering how long have I been in Canada, it's been my whole life. I have old roots here. This is my country. The first Sikh temple was opened by my family, Pape Gurdwara. I want to serve my country. I've passed the equivalency exams. I have shining reference letters from Canadian and American physicians, former program directors, chief of psychiatry, you name it. All I want is the chance to serve my nation and my people. Give us the opportunity to move forward and see what we can do on the front lines. We're ready to serve. We're ready to serve our country. Give us a chance. Thank you.
And I would note Dr. Sue-Marie is currently working in real estate, but he is obviously, there's no real estate happening right now. He wants to help people. Now, if I could have, and also as a medical consultant, I'd ask Dr. Aisha to come and say a few words as well.
Thank you, Mayor Brown. I'm Aisha Badi-Zaman. I am also an internationally trained physician. I came to Canada around 6 months ago, and I graduated from my medical school in Bahrain, and I have around 4 years of clinical experience in the Middle East since then. I'm here today representing an informal community of more than 800 internationally trained physicians from across Canada who want to help out the healthcare system against the current COVID crisis. And we're just waiting for the provinces to allow us to do that. We want to do what we have been trained to do. We want to work as doctors. We want to help out in the front lines. We want to serve Canada. And we are just waiting for the opportunity. Thank you.
Thank you so much, Dr. Aisha, for sharing your story. At this point, we're happy to take any questions. I see we have Pam from City TV. Is that the first one?
Hi there. Yes, it's Pam Seidel from City News. How are you? Thank you for taking my call. I'm wondering if anybody can speak to a little bit more about what the reasons are that the government is so hesitant to go ahead with this. Is this fear of eventual job loss? What is the reason, do you think?
Well, first of all, it's not because of talent or capability, because we have equivalency exams that these physicians have passed. So they've passed all the Canadian exams. Obviously, it's a monetary decision. There's only so much in the health budget, and governments have been hesitant historically to expand that health budget. At a time of a crisis like this, where the lives of our friends and neighbors and loved ones are at risk, I really believe we need to check concerns over the health budget at the door and make sure that we can protect lives. And we have physicians who can help run ventilators. We have physicians who can help care for patients that are going through pneumonia. We need these extra hands right now.
And just a quick follow-up, Mayor. Do I understand correctly that these doctors and nurses are prepared to volunteer without pay?
I think right now they're willing to help any way they can, and I'm sure there is those that would volunteer. There are those that would welcome any form of remuneration, because obviously they have to put food on the table for their families. If they're working in packaging plants in Brampton or real estate firms in Toronto, obviously they have to put food on the table. But I can tell you, they've come forward to us because they're driven to care for people during this pandemic. And I can't comprehend why we'd have someone who can actually save a life be working in a packaging plant right now when they're ready and willing to help hospitals that are understaffed.
Mm-hmm. Thank you.
I see Christina from City News is also on. Christina, are you there?
I am here. I'm here.
Okay.
Can you hear me?
Yes.
Hello? Okay. How quickly do you think that these doctors could actually be in hospitals and working on the floor and helping?
So these physicians tell me since they passed the equivalency exams, they'd be ready to help tomorrow. So we're concerned about having enough human resources in the hospital right now. The fact that we have this talent pool in Canada ready to help immediately is an extraordinary asset we have that we're not utilizing. And the fact that Brampton, for some reason, has so many of these physicians, I felt compelled, along with Councillor Williams and Singh, to speak up on behalf of our city and saying we can help out not just in Brampton, but around Ontario and Canada.
And then just a quick follow-up. I mean, passing the equivalency exam is one thing, but there's a lot of administrative and red tape that comes along with being a licensed medical doctor in Ontario, including having proper insurance in case of malpractice and things of that nature. So how do you get around all of that?
Well, there's two things I would reference. The fact that New York and New Jersey, who are facing the pandemic at a further state than we are, obviously it's much more serious right now in New York. The fact that they've been able to adopt this, why not learn from jurisdictions who are battling the pandemic further along than we are? If New York and New Jersey can do this, why can't we in Ontario and Canada? I understand that there's a residency period that they would have to complete, but residents can help out in the hospital. If they are doing their residency right now, that's an extra hand. Residents can do extraordinary medical work. Residents help save lives too. Let them in the hospital, let them help. And that's our pitch and ask to the province today.
Thank you.
I see we have Nerva from The Pointer who's on.
Nice to know that, but no worries. Hello, can you hear me?
Yes, I can hear you.
Oh, sorry. So I just have a question under the fines that the city is laying. So has the city itself received a legal opinion, whether that be, from internally or externally, to if the fines and charges under the COVID Emergency Measures Bylaw Act will hold up in court?
Yes, so the first thing we did is we had our legal department look at it and draft it. I want to thank our Deputy City Solicitor, Diana Sue. She's the one that actually spent her weekend last week working on this bylaw so that Brampton could be the first in the country to come out with these strict measures on physical distancing. So it has gone through legal. They will stand up in court, and grateful that so many city staff have stepped up so quickly to help at all hours.
Just a quick follow-up. What about there's lots of lawyers around the province who are kind of saying, what's the standard of evidence? So is this more of a symbolic thing in your opinion, or do you think that people can really prove that they've been breaking the law at this time?
Our legal department feels very strongly that we would be successful in court. And frankly, for someone who's foolish enough to have a keg party or a street party at the time of a pandemic, and they want to defend their conduct in court, go ahead. Those individuals have been reckless, and I think any justice of the peace would recognize that. And I would note, it's not just fines we're laying. We always try to work collaboratively first. We issue warnings at first. In the last week, we've issued 64 warnings. We may have laid 8 fines for the people that were egregious and weren't listening to the bylaw officers, but we have issued 64 warnings as well. And so we try to come at this collaboratively at first.
Thank you.
Thank you. Our next up is we have Jasleen from CTP Punjabi. Jasleen, are you there?
Hi.
Yes, Jasleen, please ask your question.
Hi there, this is Jasleen from PDC Punjabi. My question is that how city will make sure that people who are not respecting the social distance, that how city will make sure that that people make sure that they are respecting the social distancing?
So if individuals are not respecting the physical distancing, we have shown over the last week we have no hesitation to lay fines. Our fines range from $500 to $100,000. And if you want to be reckless right now, if you want to imperil the health of loved ones, of neighbors, of family members, of members of our Brampton family, you will face very significant fines. And I would note that if you see examples of this, please call 311. We've added additional resources to 311 to handle the volume. Please let us know if you hear of a party on your street or examples or people are ignoring the physical distancing. And I'm going to ask if Councillor Singh could say that in Punjabi as well.
Yeah, so ਜਿਹੜੇ ਫਿਜ਼ੀਕਲ ਡਿਸਟੈਂਸਿੰਗ ਦੇ ਕਾਨੂੰਨ ਹੁਣ ਪਾਸ ਹੋਇਆ ਉਹਨਾਂ ਦੇ ਵਿੱਚ ਕਾਫੀ ਸਖਤ ਸਜ਼ਾ ਵੀ ਆ ਕਾਫੀ ਸਾਡੇ ਉਹਦੇ ਪੈਨਲਟੀਜ਼ ਵੀ ਆ ਸੋ ਇਸ ਕਰਕੇ ਸਾਡੇ ਸਾਰਿਆਂ ਦੀ ਜ਼ਿੰਮੇਵਾਰੀ ਬਣਦੀ ਆ ਕਿ ਆਪਾਂ ਜਿਹੜੇ ਇਹ ਸੋਸ਼ਲ ਡਿਸਟੈਂਸਿੰਗ ਆ ਜਾਂ ਦੂਰੀ ਰੱਖਣੀ ਆ ਇਹਨੂੰ ਆਪਾਂ ਸੀਰੀਅਸਲੀ ਲਈਏ ਤੇ ਆਪਣਾ ਫਰਜ਼ ਸਮਝੀਏ ਕਰਕੇ ਇਹ ਸਾਰਿਆਂ ਨੂੰ ਸੇਫ ਰੱਖੂਗਾ
Harjit, I have one more question for you.
Yes.
We know ਇਸ ਵੇਲੇ Brampton ਦੇ ਪਾਰਕਿੰਗ ਲੋਟਸ ਦੇ ਵਿੱਚ ਹਸਪੀਟਲ ਦੇ ਲੋਟਸ ਦੇ ਵਿੱਚ ਟੈਂਟ ਲਗਾਏ ਜਾ ਰਹੇ ਨੇ ਸੋ ਦੈਟ ਜਿੰਨੇ ਜ਼ਿਆਦਾ ਪੇਸ਼ੈਂਟਸ ਨੇ ਉਹਨਾਂ ਨੂੰ ਜੋ ਹੈ ਦੇਖਿਆ ਜਾਏ ਉਹਨਾਂ ਦੀ ਟੇਕ ਕੇਅਰ ਕੀਤੀ ਜਾਏ ਲੇਕਿਨ ਕੁਝ ਮਹੀਨਿਆਂ ਪਹਿਲਾਂ Brampton ਸਿਟੀ ਨੇ ਹੈਲਥ ਕੇਅਰ ਐਮਰਜੈਂਸੀ ਡਿਕਲੇਅਰ ਕੀਤੀ ਸੀਗੀ ਔਰ ਹੁਣ ਕਿਸ ਤਰ੍ਹਾਂ Brampton ਸਿਟੀ ਮੇਕ ਸ਼ੋਰ ਕਰ ਰਹੀ ਹੈ ਕਿ Brampton ਦੇ ਵਿੱਚ ਇਨਫ ਮੈਡੀਕਲ ਸਪਲਾਈ ਹੋਵੇ
ਹਾਂਜੀ ਸੋ ਆਪਾਂ ਜੀ ਡਿਕਲੇਅਰ ਕੀਤੀ ਸੀਗੀ ਹੈਲਥ ਕੇਅਰ ਐਮਰਜੈਂਸੀ ਪਰ ਇਸ ਨਾਲ ਜਿਹੜੇ ਸਾਡੇ ਹੈਲਥ ਕੇਅਰ ਪ੍ਰੋਫੈਸ਼ਨਲ ਕਾਫੀ ਲੰਬੇ ਕਈ ਮਹੀਨੇ ਪਹਿਲਾਂ ਇਹਨਾਂ ਨੂੰ ਪਤਾ ਲੱਗ ਗਿਆ ਸੀਗਾ ਜਿਹੜਾ ਕਰੋਨਾ ਵਾਇਰਸ ਆ ਇੱਥੇ ਆ ਸਕਦਾ ਹੈ ਸੋ ਕਾਫੀ ਇਹਨੀ ਤਿਆਰੀ ਕੀਤੀ ਆ ਇਹਨੀ ਇੱਕ ਸੈਂਟਰ ਵੀ ਖੋਲ੍ਹਿਆ ਸੀਗਾ ਪੀਐਲ ਮੈਮੋਰੀਅਲ ਦੇ ਵਿੱਚ ਜਿੱਥੇ ਇਹਦੀ ਸਪੈਸੀਫਿਕ ਕਰੋਨਾ ਵਾਇਰਸ ਦੀ ਜਿਹੜੀ ਟੈਸਟਿੰਗ ਆ ਇੱਥੇ ਹੁੰਦੀ ਹੈ ਅਤੇ ਹੋਰ ਵੀ ਇਹਨਾਂ ਦੇ ਪਲਾਨਸ ਆ ਸੋ ਇੱਦਾਂ ਨਹੀਂ ਹੈਗਾ ਇਹਨਾਂ ਦੀ ਤਿਆਰੀ ਨਹੀਂ ਹੋਈ ਹਾਂਜੀ ਜਿਹੜੀ ਕਪੈਸਿਟੀ ਜੇ ਆਪਾਂ ਲੰਬੇ ਸਮੇਂ ਵਾਸਤੇ ਗੱਲ ਕਰੀਏ ਉਹ ਜ਼ਰੂਰੀ ਹੈਗੀ ਆ ਪਰ ਜਿਹੜੀ ਹੁਣ ਕਰੋਨਾ ਵਾਇਰਸ ਦੀ ਤਿਆਰੀ ਆ ਉਹ ਜਿਹੜੇ ਸਾਡਾ ਵਿਲੀਅਮ ਮਾਜ਼ਲਰ ਆ ਉਹਨਾਂ ਨੇ ਕਾਫੀ ਕੀਤੀ ਆ ਨਾਲ ਵਾਲੇ ਜਿਹੜੇ ਸਾਡੇ ਹਸਪਤਾਲ ਆ ਉਹਨੇ ਵੀ ਕੀਤੀ ਹੋਆ ਸੋ ਕਰੋਨਾ ਵਾਇਰਸ ਕਰਕੇ ਇਹਨਾਂ ਕੋਲ ਕਈ ਮਹੀਨਿਆਂ ਦੀ ਵਾਰਨਿੰਗ ਸੀਗੀ ਇਹਨੀ ਤਿਆਰੀ ਕੀਤੀ ਹੈ ਅਤੇ ਹੋਰ ਵੀ ਇਹਨਾਂ ਦੇ ਪਲਾਨਸ ਹੈਗੇ ਆ ਜੇ ਹੋਰ ਵਧੇ ਇਹਦੇ ਫੇਜ਼ਸ ਜਿਹੜੇ ਆ ਉਹ ਅੱਗੇ ਆ ਫੇਜ਼ 2 ਫੇਜ਼ 3 ਆ ਹੋਰ ਵੀ ਸਾਈਟਸ ਇਹਨੀ ਤਿਆਰ ਰੱਖੇ ਵਾ
Thank you.
Thank you so much.
Thank you, Councillor Singh. I see we have Momin Qureshi from 680 News.
Yeah, hey, Mayor Brown. I just wanted to know whether you have talked to any other municipalities about this push to get foreign-trained doctors onto the front lines, and if you have heard from any of them, have they supported this idea, and will they be joining your push to get the province to make this happen?
So informally, I've spoken to other mayors, and particularly in the diverse urban areas, I think there's a lot of sympathy for the plight of these physicians that want to help out. I will note that I will be sharing this with my colleagues from LUMCO, which is the large Ontario Mayors of Ontario, and the Canadian Big City Mayors Caucus that I'm a member of. And so I hope that this is something that will be joined on by other mayors. I know there's a lot of support for this, so I would just say stay tuned. I expect other mayors to be supporting this initiative as well.
And just to follow up, what are the major hurdles that are in the way right now for making this happen in terms of any legalities or permission from higher levels of government?
Well, these are extraordinary times. I would note in New Jersey and New York that are not very far away, they managed to remove all those legalities and hurdles because we're in uncharted waters right now. In terms of the immediate challenge, it's financial. There's only so much room in the physician budget. That's the number one hurdle that needs to be averted. The second one is opening up more residency spots. If you opened up the residency spots, they could be working in the hospital right now. And so I think those are the two key components that need to be addressed.
All right, thank you.
And is Graham from the Brampton Guardian on, our local newspaper, our local daily? Graham, are you there? I don't see Graham. On that note, I want to thank everyone for our weekly update here in Brampton, and thank you, Councillor Singh, Councillor Williams, and to our two physicians that took the time out of their schedule to be with us today, Dr. Sumari Chauhan and Dr. Aisha Badez Amin. And to Dr. Akbafori, who wanted to be here but is working in his packaging plant today, thank you for your advocacy as well.